Today's topic is tongue. So, there's a saying, mind your tongue. You can say sweet words with your tongue. You can sing, and also you can signal with your tongue. And also you can call a friend by whistling. If you are sad, you just whistle a tune, a few lines of a song with the help of your tongue and vocal cord. I'll narrate a story. In 1988, I was attending a conference, first Asia-Pacific conference on anatomists, and with a friend of mine, friend means a dada, I would say, we had gone to Connaught Place, the heart of Delhi. But it was 11 p.m. We could not get a taxi or auto. Any autos going on? He said no. Then what I did, hey bhai, he did not respond, he went off. Another auto came, I whistled. I whistled and he stopped. Then I asked him, would you go to IMA house? Indian Medical Association has a guest house in where the headquarters of Delhi Police building is in the, if you are going to Jamuna, then it is on the left side, right side is IMA. It's just hardly 2 kilometers from Connaught Place. And that guy was going to Jamuna Park. Beyond Jamuna, incidents, now you can practice, you can signal, you can call your friend, you're sad, you use your tongue, and also you do some mistake, you do this. Or we worship goddess Kali, especially in Bengal. You will see during Diwali, different types of goddess Kali are worshipped with small tongue, big tongue. Now you ask ChatGPT, what is the significance of goddess Kali's tongue being protruded? Okay, with this small introduction, I will be just going through tongue. Now you see the open mouth. You stand in front of the mirror and you see your oral cavity and the tongue. And the movements, the tongue can, you practice. You lick an ice cream. This hot summer, you lick an ice cream. And you lick many things. Also you can taste. It's an organ of taste. And your uvula, this is the uvula, forces the upper lip. This is the upper lip, palatoglossal muscles, palatine tonsils, this is the tongue. This is the undersurface of the tongue. Everybody ghudi diyeche. You see, whenever you see a patient, you observe and you ask to show the tongue. If any patient is having high temperature, then it will be a coated tongue. You will go to clinics, you will see. And the different types of tongue will give you a clue to any specific disease or the pyrexia. Now tongue is a mobile muscular organ in the floor of the mouth. It is important in taste, mastication, swallowing and speech. We have a very good specimen in the department. When you go for your practicals, you ask whoever is in charge and you see it yourself. That if the thing, and of course, if you want to study, you have your tab and also your mirror, and at the same time you can study. Now, see, this is the lingual tonsils, this is the palatoglossal arch, midline sulcus, these are the valate papillae, folate papillae, and filiform papillae, lingual papillae, and fungiform papillae, apex, this is the apex, this is the base, and this is the foramen cecum, this is the epiglottis. You take a spoon and your roommate, you just depress the tongue and see the internal part. You will get a clear picture. Tongue surface features composed of chiefly skeletal muscles covered by mucous membrane. Its anterior 2/3 lies in the mouth and posterior 1/3 in the pharynx. The posterior part, 1/3 of the tongue, is in the pharynx. It presents a tip, a dorsum, the inferior surface, and the root is the root. Tip, the dorsum, dorsal surface. It will do ulte down, jib ulte down, and you will see, and in front of the mirror, you will now the dorsum, the inferior surface, and the root. Tongue surface features, tip and margin. Tip with the or apex of the tongue usually rests against the incisor teeth. The margin of the tongue is related on each side to the gums and teeth. Root rests on floor of the mouth, that is geniohyoid, mylohyoid attached by muscles to mandible at the hyoid bone. In the floor of the mouth you can see the muscle. Now, and nerves, vessels and extrinsic muscles enter or leave the tongue through its root. Yeah. Dorsum of the tongue is the palatopharyngeal arch. This is the epiglottis, the median epiglottic fold. This is the root, lingual follicles. Palatine tonsils, these are the palatine tonsils. This is the foramen cecum. The palatoglossal arch, the terminal sulcus, valate papillae, these are the valate papillae, and fungiform papillae, and the median sulcus, filiform papillae. Now, this is the apex, situated partly in the oral cavity and partly in the oropharynx. This is demarcated by a V-shaped groove. This is demarcated by a V-shaped groove, sulcus terminalis. Sulcus divides into anterior 2/3 in the oral cavity and posterior 1/3 in the oropharynx. Sulcus divides into anterior 2/3 in oral cavity and posterior 1/3 in oropharynx. Apex of the sulcus terminalis projects backwards, is marked by a small pit foramen cecum here. Dorsum of the tongue, oral part of the tongue divided into left and right halves, a shallow groove, exhibit lingual papillae of the four types, a filiform papillae, fungiform papillae, valate papillae, and foliate papillae. It's all in this part. Valid, oleum, fungiform. This is the lingual papillae. Filiform, fungiform. This is the apex. Pharyngeal part of the tongue, devoid of papillae, contains lymphatic nodules, lingual tonsils. These are the lingual tonsils here. Smooth, inferior surface is smooth, devoid of papillae, connected to the floor of the mouth by a fold of mucous membrane, frenulum of the tongue, the frenulum of the tongue. Sometimes the frenulum is long, it goes. Okay, now a mother comes with his 2 years or 3-year son or 4-year son, boy or a girl, Dr. Babu, আমার ছেলে ঠিক কথা বলতে পারে না, কালি কালি বলতে টালি টালি, the tongue movement is restricted due to the tongue tie by the frenulum. So when you are examining a child with this complaint, you tell him to utter kali. Kali. Tongue is inside the apex, the frenulum is tied. Now, there's a simple operation. Previously, general surgeons used to do it. I had done many. And you have to do a Z-plasty. No, it is the tongue apex is tied up like this. Yeah. So there's a dip. There's a dip. There's a dip. Behind the teeth. It is behind the teeth. Naturally, the frenulum. What you do is, if it is a long, then you do a Z-plasty. And now this is cut. Now this. Now this end will go here. This end will go here. And it lengthens. It is lengthening. This is one technique. If it is small, then you don't get so much of the tissue that is tongue-tied. So you just snip with a fine scissors. Snip. This operation is being done by the dentist now. So you refer to a dentist, and if you are a general surgeon, you can handle it. It's nothing. Now deep ligament can be seen beside the frenulum. This. আজকে গিয়ে মিররে দেখবে, you see the deep blue veins are there, and deep lingual vein can be seen beside the frenulum. Lateral to the vein mucous membrane fold is called plica fimbriae. Muscles of the tongue are of two types, intrinsic and extrinsic. All the muscles are bilateral, those on one side being partially separated from those of the opposite side by a median septum. Now, I presented a paper in one conference, National Conference of Anatomy. Do avascular plane exist in tongue or scapula? In this month of Chaitra, especially in parts of India, rural Bengal, even south, there is a folk puja that is known as Dharam Puja. And also during the end of the thing, during Charak, you still have then Singapore, Thailand, Bali, all that area, the people have, the kebab sticks. There's a steel stick. It is like that. Needles. And the bhakt who fasts during the day and then in the evening take some food. And on that date, Chaitra Sankranti, that day, they offer themselves and they pass the needle. Needle means thick stick. Not exactly, there are different diameters of kebab sticks are there. So it's but quite the person who handles this, and of course there is dholak and dhol and bajna, there is music, and the person is in trance, and you see she's going there, she pulls the tongue and puts the needle. Bloodless. And then he starts dancing, or she starts dancing. That's why I went and saw that in the evening, the festival started at the evening, and till night, they are putting in needles. They have mannat, whatever you say, for some occasion, some things they pledge to God, and they put pairs. But there's no bleeding. Actually, the anatomy lies there. The tongue, the blood supply as I go, you will see, and also the muscle. Another thing, the scapula, in Kolkata, even last Chaitra, there's 2-3 places they continue this festival. You see, think of Calcutta's dimension and think the ritualistic practice that is being, till date, it is being offered. And what they do, they have a rope and they have like this hook, steel hook, and a person in this region, similarly, 2 hooks are there in the scapular region. The hook that hook is pierced both the thing. And then two persons, to keep balance, it goes round and round, round and round, round and round. But it does not tear off. It does not bleed. You can imagine a height more than this. In the pole, central pole, and bamboo is there. Two persons hanging with their hook on, not like straps and this thing, or you are doing your. So all muscles are bilateral, those on the one side being partially separated from those of the opposite side by a median septum. Now, extrinsic muscles, they are genioglossus, hyoglossus, styloglossus, and palatoglossus. Now, this is your stylohyoid ligament. This is the styloid process. This is the tongue. This is inside the tooth. These are the genioglossus and extrinsic muscles, lateral view, hyoglossus and hyoid bone. From the hyoid bone to the tongue, and their actions are to move the tongue. Now these are the muscles: genioglossus, hyoglossus, styloglossus, palatoglossus. Now what I tell you regarding the avascular plane, because if there is a growth in the tongue, a cancerous growth or papillomatous growth, then you might need to portion of the tongue is cut off. Only half portion is left. Now intrinsic muscles are confined to the tongue itself, not attached to the bone. Superior and inferior longitudinal, transverse, vertical, their action is extrinsic, is intrinsic. Superior longitudinal, transverses, and vertical and inferior longitudinal. These. Movements of the tongue, protrusion brought about by genioglossus of both sides acting together, retraction produced by styloglossus and hyoglossus of both sides acting together, depression produced by hyoglossus and genioglossus of both sides acting together. The shape of the tongue is modified by the action of the intrinsic muscles. So the intrinsic muscles is the shape and the movement of the shape of the modified action of the intrinsic muscles. Now, arterial supply, lingual artery, tonsillar branch of facial artery, ascending pharyngeal artery, venous drainage, deep lingual veins join the sublingual vein and the dorsal lingual vein, and finally into the internal jugular vein. Tip and frenulum, submental nodes, medial part of the anterior two-thirds of the inferior deep cervical nodes, lateral part of anterior of tip and frenulum, submental nodes here, and medial part of anterior two-thirds inferior deep cervical nodes, lateral parts of the anterior two-thirds submandibular nodes here, and posterior one-third superior deep cervical nodes. Nerve supply, motor, general, special, sensory. Special. Now motor supply, all intrinsic muscles are supplied by hypoglossal nerve. Here's the hypoglossal nerve here. All extrinsic muscles are supplied by hypoglossal nerve, except palatoglossus, which is supplied by cranial part of accessory. Thus, the nerve concerned with motor supply to the tongue are 11th and 12th cranial nerves. This is important. Every part of the tongue, a question can come. It's a small piece. It's a small piece, but in the chances of say blood supply, nerve supply, or name the muscle, draw a diagram on the of the tongue, and sensory nerve supply supplied by lingual nerve, a branch of the mandibular nerve for general sensation. Supplied by chorda tympani, a branch of the facial nerve for taste. Now, if you take a red chili from Assam and you bite it, when my daughter was small, young, a child, I used to take her to some restaurant and chow mein we used to order. I used to tell her, you take a bite of this red meat. Then he says, no. And I used to tell, no, if you take it, see, Duma will come out, smoke will come out from your ear. That is the tympanic membrane supplied by chorda tympani, a branch of the facial nerve for taste. তুমি যদি ঝাল খাবে না কান টান লাল হয়ে যাচ্ছে হ্যাঁ তো বলি আমি তখন ওদেরকে বলতাম যে you get smoke out of your ears. Okay, now this is just to supplied by chorda tympani, sensory, for taste. তুমি খেলে and you in the ear, the chorda tympanic membrane, posterior 1/3 of the tongue, supplied by lingual branch, glossopharyngeal nerve for both general sensation and taste. Small contribution from internal laryngeal branch of the vagus nerve for both general sensation and taste. Tongue nerve supply, you can see palatoglossus, vagus nerve, 10th nerve. Now, internal laryngeal nerve, here, this portion, glossopharyngeal nerve, general and special senses, CN9, and valid papillae, overlapping nerve supply. All other muscles of the tongue, hypoglossal nerve, CN12, lingual nerve, CN V3, general sensory, chorda tympani, CN8, and special sensory nerves, motor nerves, superior view. This is a good diagram. You practice because you will be asked, maybe asked, I won't say you will be asked for this exam. Gag reflex, paralysis of genioglossus, injury to the hypoglossal nerve, lingual carcinoma, frenectomy, that frenulum I told you, frenectomy, thyroglossal duct cyst, aberrant thyroid gland. Now, world's longest tongue, German schoolgirl Annika Armella has a whooping 7 centimeters tongue. Okay, the 12-year-old from Tankstedt near Hamburg can lick the ice cream from bottom of the cornet through a cornet, cone, ice cream. Then she can, and I could make some money with it one day, she said. My friends always said I had a long tongue and I could make some money with it one day, she said. If she could stand in a park or something like that, take an ice cream and licking, and people are giving her money. So, and Annika has licked her way into the Guinness Book of Records with her 7 centimeters tongue. So 7 centimeters tongue. Thank you.